So at the first visit, I like to see you at the first visit unless I'm either out of town and there's other extenuating circumstances. My preference is for you and I to connect at your first visit so that we can go over the surgery, talk about what we did, if there's anything different or anything to expect that may be different than I told you preoperatively. I'll go over your exercises again that I like you to do. You'll have all your questions answered. We'll talk about what to look for in the next few weeks, and we'll get x-rays at that visit and check your incision. So let's talk a little bit about sling use. The sling is not a cast. It's not something that has to be stuck to you 24/7. But if you're sitting in a chair in a controlled environment, you can have the sling off and have your arm resting on your lap. You'll want to break from the sling. It digs into your neck. You'll get tired of the fabric on your arm, so you can take the sling off, have it resting on your lap. If you're up and about, wear your sling. If you're going to the store, wear your sling. If you're going from a sitting position to the bathroom and you're going to be right back, you can hold the arm. If you're going to the kitchen to get something to eat and coming right back, you can hold the arm. You don't have to put in the sling for those. As time goes on, your pain is going to get better and you're going to be tempted to use the arm more. That's another time where you might want to wear the sling, even though you're not having a lot of pain, if it reminds you not to do things with the arm that you shouldn't be doing. But the sling is not a cast. You can take it off. You can have your arm on your lap. After shoulder surgery, sleep can be a challenge. Most people find it more comfortable to be sitting propped up, either in a recliner, propped up on a couch, or semi-upright in a bed. It's not that you're not allowed to lie flat. You can lie flat if it's comfortable for you. If you want to lay flat, you would have a pillow behind the elbow to keep the arm from sliding back. That'll be more comfortable. Most people find it more comfortable to be propped up in a chair. If you're in a chair, you can undo your sling and just have your sling on your arm for the first 1 to 2 weeks. After that, you could take the sling off to sleep, unless you're a restless sleeper and you might find your hand over your head or something wild like that. But if you're just in bed, comfortable, you can have pillows behind the arm and have your arm like this to sleep.